if you stress too much, it can actually make your hair fall out. And today we will talk about all the ways that science has taught us we can slow or even reverse hair loss. There are both mechanical and chemical approaches to slowing and reversing hair loss. It's one of the longest standing treatments for halting and reversing hair loss is so-called minoxidil. There are two major routes by which people get minoxidil to the hair follicle. One is to take it systemically as a pill where it goes into the general circulation. The other is to take it topically as a cream. Typical concentration is going to be a 5% concentration that people will use once per day. It's also important, by the way, if you're going to take this route, that you actually leave that solution on the scalp for 3 to 5 minutes. This is important and should make complete sense as to why it's important. You can't just rub the stuff into your head and then rinse it off and expect it to be absorbed. It actually needs to seep down into those hair follicles and access the niche. I should also mention minoxidil treatment, if you pursue it, is likely something that you are going to have to do for the rest of your life if you want to hold on to the hair growth that you obtain with minoxidil, or if you want to maintain the hair that you are already maintaining with minoxidil. Most everyone who goes on minoxidil has to stay on minoxidil because when they cease taking minoxidil, they lose the hair that they gained with minoxidil. So now I'd like to discuss the ways that one can chemically adjust certain things within the hair growth pathway in order to stimulate hair growth or halt hair loss. The first thing on this list is actually going to be pretty surprising to a number of you, and that's caffeine. Caffeine does many things besides stimulate our central nervous system and make us feel less sleepy, however. By applying topical caffeine ointment or cream to the scalp, you can suppress PDE sufficiently enough to increase IGF-1 and increase some hair growth, or at least maintain hair growth in that region. Topical caffeine application can be as effective as minoxidil application without actually lowering things like blood pressure and some of the other negative side effects of minoxidil. Keep in mind that topical caffeine ointments shouldn't necessarily be applied every single day. So this is the sort of thing you might do 3 times a week. And also, don't be surprised when I tell you what I'm about to tell you now, which is no, you can't simply just drink more caffeine in order to accomplish the goal of offsetting hair loss. Now, keep in mind that both minoxidil and caffeine are generally used as a preventative for reducing hair loss over time. They are not expected, and they do not, as far as we know, create new hair growth to any sufficient degree. Another commonly discussed and used commercial compound for offsetting hair loss and stimulating hair growth is ketoconazole. Ketoconazole has been shown to be effective in increasing hair number. It's also been shown to be effective in increasing hair diameter. The use of ketoconazole shampoos 2 to 4 times per week with a scalp contact time of about 3 to 5 minutes has been shown to give about an 80% response rate of maintaining hair that would otherwise be lost. So that's pretty dramatic, 80%. Now, if you decide to use ketoconazole as an approach to offsetting hair loss, it's very important that you get a hold of a shampoo that's at least 2% concentration of ketoconazole. This is important because a lot of the ones that are available out there, especially online, are going to be 1% or lower. So you want to try and obtain a ketoconazole shampoo of 2% or higher concentration of ketoconazole. There are newer and now, fortunately, a greater variety of ketoconazole containing shampoos. We as a podcast and I don't have any affiliation to any of these, but I will provide links to a couple of the more prominent ones that are known to have 2% concentration of ketoconazole, as well as some other things in them known to offset some of that dryness and brittleness that ketoconazole shampoos can trigger. The major player in this whole story to maintain or increase hair growth is going to be finasteride. Finasteride treatment done properly can reduce hair loss in 90% of all people that take it. Finasteride is effective in reducing DHT because of its actions in reducing the type 2 isoenzyme or isoform of 5-alpha reductase. Finasteride reduces DHT. That's the net product of finasteride. And in doing so, it can increase hair count by as much as 20%. Pretty remarkable if you think about it. In addition, finasteride treatment done properly, which we'll define in a moment, can reduce hair loss in 90% of all people that take it. So that is near staggering. There aren't many pharmaceuticals out there that have that kind of efficacy. Really dramatic. And in addition, it's known to increase hair thickness by about 20 to 30% overall. So not just create new growth of hairs and thicker hairs, but whatever hair you do happen to have on your head, it can further thicken those. The issue with finasteride is twofold. First of all, It is known to have some pretty significant side effects if it's not dosed properly and in particular populations of people. And this is because there is a wide variation in the amount of the different isoenzymes that people make. But the catalog of side effects that people experience at a given dose varies widely. So there's a lot of trial and error that has to take place. Finasteride comes in two major forms. There's an oral form and there's a topical form. Topical finasteride is typically taken in 1% solution or ointment and rubbed into the head. Sometimes it's now also incorporated into shampoos, but typically it's put into a solution that people rub into their head. And it is thought that the 1% solutions are equivalent to 1 milligram of systemic finasteride. The dosage recommendations that I was able to arrive at based on the clinical studies and frankly in discussion with some doctors who prescribe finasteride were the following. 0.5 milligrams to 1 milligram of finasteride as a tablet per day seems to be an effective and pretty safe starting place for most people. The key thing here is that one is going to have to wait some period of time to see whether or not any hair growth occurs. It is a naive and frankly a foolish approach based on what we know about the duration of that anagen phase of the hair to do one of these treatments, wait a week or two, and then decide to up your dose. To simply increase your dose because you're not getting results quickly enough, that's not going to be the best approach. I really encourage people who are going to explore the finasteride route to think of this as a long-term project and to really ratchet up slowly, if at all, starting initially with a low dose taken for a long period of time, maybe even as long as 25 weeks before considering going up any further. Microneedling, as the name suggests, is taking a bunch of little needles, either in a little stamp, so a little square, or nowadays typically it's a roller. So it looks like a paint roller, except it's got tons of little needles in rows all over that roller. Those needles range in length from 0.5 millimeter to 2.5 millimeters. And one rolls that over the scalp. And if you're thinking, ouch, that probably hurts. Indeed, it can hurt a little bit or a lot, depending on the thickness and the length of those needles. Microneedling has been shown to do two things. It has been shown to reactivate semi-quiescent populations of stem cells that are in that telogen phase, putting them back in anagen phase, and thereby stimulate more hair growth. It has also, and this is, I think, the best use of microneedling, it has also been shown to be a very effective augment for some of the hormone-based hair regrowth tools and pharmacology that we're going to talk about in a few minutes. That the micro part of microneedling is absolutely key, and this should be obvious to you when you think about scars. I don't know about you, but I've never seen a scar with hair growing out of it. Or if there was, it was probably like one hair. But if you've ever seen a scar, if someone had their appendix out or if someone had a brain surgery, you see that scar because there is no hair growing out of it. So the micro portion of microneedling is extremely important. We are not talking about causing significant damage to a tissue in order to activate that stem cell population. We're talking about causing micro damage and micro levels of inflammation to stimulate growth. But if you're interested in using microneedling alone or in combination with some of these other treatments, that needle lengths of about 1 millimeter to 2.5 millimeters seem to be more effective than shorter needle lengths. So if you're scared of the needles and the needle lengths, keep in mind that done properly, microneedling shouldn't be too painful. Some people experience a little bit more pain than others, but it's not considered a very painful procedure. One thing that's very clear is that the combination of microneedling and minoxidil treatment together is far more effective than either of those treatments alone. In addition, the combination of microneedling and minoxidil has been shown to be effective in recovering what are called dead zones. So these are regions of the scalp that are either completely bald or mostly bald, for which there is essentially no stem cell population there, and the combination of minoxidil plus microneedling is somehow able to recover those stem cell populations and allow new hair to grow. Although the growth of that hair in those dead zone regions can take a very long time, 30 to even 50 weeks. Neither minoxidil treatment alone nor microneedling alone has been shown to be effective in recovering these so-called dead zones when those treatments are done separately. So this, I would say, is a strong reason to consider combining microneedling and minoxidil as opposed to just doing minoxidil or just microneedling. So there's one very direct way to increase hair growth and maintain the hair that you have on your head, and that's to increase IGF-1. That can be accomplished through prescription drugs such as growth hormone and things that stimulate the release of growth hormone and IGF-1. Keep in mind, growth hormone is released from the anterior pituitary during the first hours of sleep, especially when you haven't eaten anything for the 2 hours prior to sleep, and especially when you get regular bedtimes. And there are prescription approaches, and those are growth hormone itself and things like sermorelin, which is a peptide that increases growth hormone. It's actually a secretagogue. It causes the secretion of growth hormone and thereby increases in IGF-1. This is well documented. Both growth hormone and IGF-1, as I mentioned, are available by prescription. They are not without their side effects. The other thing about stimulating the natural production of IGF-1 is that, as its name suggests, insulin growth factor 1, it is insulin dependent in many ways. So one of the things you really want to pay attention to is to avoid being insulin resistant. So if you're carrying a lot of excess body fat, if you're obese, or if you have type 2 diabetes, meaning you're insulin resistant, you're going to want to deal with that. In addition to that, regular cardiovascular exercise and resistance exercise, making sure that your body fat percentage is not in excess of where it needs to be. The other thing that's really important for maintaining proper hair growth, this anagen phase, is that you need sufficient iron. This is because iron and ferritin play a key role in the cell growth pathways that go from the stem cells to the stimulation of keratin within the hair itself. For women, the levels of iron that you want are somewhere between 25 and 100, and for men, somewhere between 30 and 150. Fortunately, the tests or the blood tests for iron are usually a very inexpensive add to your current blood panel. Iron plays a key role in the anagen phase of hair growth, so you want to make sure you at least have sufficient iron, and if you don't, you want to make sure that you're getting it from nutrition and or supplementation. Combination treatments that involve a mechanical stimulus and a chemical stimulus are always going to be better than either one alone. And within the mechanical category, the stimulus that seems to work best is microneedling. So the combination of microneedling and finasteride can lead to some pretty robust and impressive hair regrowth. So much so that people that were, I guess we'd only describe them as pretty bald or bald, can regrow significant amounts of hair. So the combination of microneedling and finasteride is probably the most effective way to go.